My reaction when I found out, I wasn't surprised, but I was concerned because we didn't know exactly what we were dealing with at the time. I had a good suspicion that it was ovarian cancer this time, considering where it was. As far as my outlook on life, it really didn't change much. I've always known that, we're just here for an amount of time, and we don't know what our time is, when our time is going to be up, and, it just confirmed once again that we need to live every minute of our life of every day as best we can and as full as we can. How did it affect me? It did what it usually does anytime my mother has had cancer. It puts my brain into overdrive, and I ask a lot of questions, do a lot of research, because I want to know exactly what we're dealing with, because the rest of my family doesn't tend to handle things too well and think very clearly. So that's what my role is. Yes, I was concerned, wasn't particularly scared, didn't have time to be scared. It's, of course, very important for everyone to get their breast exam and their yearly pap smear, and even men need to go and have a yearly checkup. It's not always going to catch stuff that early, but it doesn't hurt, They have tests out there that they can take, that you can do to find out if you're, turn it off for a second. As far as testing, everyone knows that you need to go every year. Women need to get their pap smears and their mammograms. Men at a certain age especially need to go, and they need to get their testing done for prostate cancer and stuff. There is a test that they can do to find out if you have a specific abnormality on a gene, to see if you're more apt to have cancer as not. It's fairly accurate. It doesn't hurt to get it done. But as far as your body, you know your body better than anyone else. If there's something going on and your doctor does not listen to you, then go find another doctor, because you know your body better than anyone.
Well, my first reaction was, of course, a little bit of shock. But having been diagnosed 2 times before with cancer, I wasn't all that shocked, if that makes any sense. It's almost as if I expected it, but I definitely wasn't ready to lose her or anything. So it was a very emotional time. Well, it affected me in a lot of different ways. The first way was the fact that I am the only nurse in the immediate family. So of course everyone came to me with questions, wanting to know as far as treatment options and, kind of what to expect. So of course I had to not only play the granddaughter role, but the nurse role as well, and fill them in with what limited information I had as far as hematology and oncology was concerned. Based on my brief experience on the pediatric floor that had St. Jude's patients. It was tough. It was very, very tough. It didn't change my outlook on life so much as it did make me appreciate the fact that my grandmother was still alive and your great-grandmother was still alive, and that we needed to be more conscientious about time and effort spent communicating and trying to spend time with her. I would recommend for anybody, especially if you have a family history of cancer, that you need to get your appropriate screenings. Make sure you're going every year and having your checkups done. Whether you think you feel healthy or not, you don't have to feel anything. And there are millions of people who go every year thinking they're feeling fine, and then the doctor finds something that they weren't expecting. Sometimes it's terminal cancer. My grandmother was very fortunate in the fact that even though it was late stage cancer, with all of her aggressive treatments and surgeries that she underwent, and had the foresight to go ahead and do so, that she is a cancer survivor now. Yesterday was actually 1 year ago that she was diagnosed, and she has had her clearance here for just a few months. So time is of the essence. It's very important. You guys need to make sure that you are getting your checkups. If your mom or dad are not getting their checkups, make sure you encourage your family to get that done as well, because it really can save their lives and your life too.